Hello! In this video, we'll explore the world of pediatric physical therapy, a field dedicated to improving the lives of infants, children, and adolescents through movement and rehabilitation. I chose pediatric physical therapy as my topic because it is the career that I want to pursue for my future job. Pediatric physical therapists, or PTs, are specialists who work with children from infancy through adolescence. Their main goal is to help these young individuals improve their physical function and mobility. This involves a range of responsibilities. They first begin by assessing patients' physical abilities and needs. Based on this assessment, they develop individualized treatment plans tailored to each child's unique situation. To implement these plans, pediatric PTs utilize various methods, including therapeutic exercise, play therapy, and assistive devices. They work to enhance crucial skills like motor skills, strength, balance, and coordination. Additionally, a key aspect of their role is educating families on home exercises and adaptive techniques to support the child's ongoing development. They also collaborate with parents, teachers, and other healthcare professionals to provide comprehensive care. Throughout the treatment process, they monitor patient progress and adjust treatment plans as needed. They also document patient evaluations and treatment outcomes. Pediatric PTs may also provide advice on the use of mobility aids such as braces or wheelchairs. To effectively perform these duties, a pediatric physical therapist needs a diverse set of skills and abilities. Strong communication and interpersonal skills are essential for interacting with children and their families, as well as collaborating with other professionals. A deep knowledge of child development and various pediatric conditions is crucial for accurate assessment and treatment planning. Given the nature of working with children, patience, empathy, and adaptability are vital personality traits. Pediatric PTs must also possess strong problem-solving and critical thinking abilities to address the unique challenges each child presents. Finally, the job requires physical stamina for assisting patients in movement. Pediatric PTs work in a variety of settings to reach the children who need their help. These include hospitals, outpatient clinics, schools, and rehabilitation centers, and even home health services. The typical work hours can vary depending on the setting. PTs in hospitals and clinics generally work around 40-hour weeks, while those in school-based positions often follow academic schedules. Home health PTs may have more flexible hours. In terms of physical appearance and dress code, most pediatric PTs opt for comfortable, professional attire, such as scrubs or business casual clothing, always paired with athletic shoes for ease of movement. The field also offers several opportunities for career advancement. PTs can choose to specialize in areas like neurology and orthopedics. They may also advance into leadership roles, becoming a clinic director or a department head. Finally, some experienced PTs may choose to take the entrepreneurial route and consider opening a private practice. Beyond professional development, certain personality traits are highly valued, including compassion, patience, strong communication skills, and adaptability. Maintaining good physical health is also necessary due to the physical demands of the job, requiring the ability to lift, bend, and support patients safely. To become a pediatric physical therapist, a significant amount of education and training is required. While the profession is open to all genders, individuals typically enter the field in their mid to late 20s after completing their education. The journey begins with obtaining a bachelor's degree in a related field such as biology, kinesiology, or exercise science. Following this, A Doctor of Physical Therapy degree, or DPT, is mandatory. These DPT programs are typically 3 years in length and include clinical internships to provide hands-on experience. Upon completion of the DPT program, aspiring PTs must pass a license examination, which is the NPTE, National Physical Therapy Examination, and obtain a license from the state. But overall, the total years of education typically amount to around 7 years. Clinical internships and hands-on training during education programs are vital for gaining practical experience. Compensation for pediatric physical therapists can vary based on experience, location, and specialization. Beginning salaries are typically around $60,000 to $70,000 per year, with average salary being approximately $85,000 per year, and the median salary around $90,000 per year. Experienced PTs with specializations can earn an exceptional salary of over $120,000 per year. Additional certifications and specialization can increase earning potential. In addition to salary, most positions offer benefits such as 2 to 4 weeks of paid vacation and paid sick leave, which varies by employer. Other common benefits include medical, dental, and vision insurance, and 401k retirement. Some places also offer continuing education support. For those looking to demonstrate advanced expertise in the field, there is the Pediatric Certified Specialist certification offered by the American Board of Physical Therapy Specialties. Obtaining the PCS certification involves passing an exam and meeting specific clinical practice requirements, showcasing a high level of expertise in pediatric physical therapy. The primary professional affiliation for physical therapists in the United States is the American Physical Therapy Association, or APTA. There are several ways to gain valuable experience. These include volunteering at pediatric rehabilitation centers, shadowing practicing pediatric physical therapists, and of course, completing clinical internships in pediatric settings. To strengthen your resume, consider participating in research projects related to pediatric physical therapy, attending relevant workshops and conferences, and obtaining specialized certifications. The job outlook for physical therapists, including pediatric PTs, is positive, with demand expected to grow across the country due to increased awareness of early intervention and rehabilitation needs. Specifically, Michigan has a strong demand for pediatric PTs, particularly in hospitals, schools, and outpatient clinics. Pediatric physical therapy is closely related to other healthcare fields, such as occupational therapy and speech-language pathology. Pediatric PTs often work collaboratively with physicians and pediatricians who refer patients for therapy, as well as with special education teachers to develop individualized education plans, also known as IEPs. The profession of physical therapy itself began in the early 20th century, with pediatric physical therapy gaining prominence as medical advancements increased survival rates of children with disabilities. Since then, the field has evolved significantly, incorporating modern rehabilitation techniques and assistive technology. Overall, pediatric physical therapy is a dynamic and rewarding career path for individuals who are passionate about working with children and making a tangible difference in their lives. It requires a strong educational foundation, a dedicated skill set, and a compassionate approach. So whether it's helping a toddler take their very first steps or supporting a teenager as they regain strength after an injury, pediatric physical therapists are there every step of the way, literally. It's more than just a job, it's a movement towards brighter futures, one child at a time. Thank you for watching.